Now, we regularly hear on this programme that taking care of children's mental health is extremely important. But what is the right way to go about it? A new piece of research says many schools are struggling to support pupils because teachers don't know what type of help they need. Figures show 50% of adult mental health problems start at the age of 14. And the charity Place to Be, who's behind these new findings, argues this is proof that early intervention is key. Well, it's calling for all primary and secondary schools to receive more funding and counsellors. Well, let's speak now to Danielle Forbes. Her daughter received counselling at school when she was 7. Sam Barakat, who started experiencing depression and suicidal thoughts when she was 16. Nicola Percy is with us as well, head teacher of New North Academy Primary School in North London. And also with us is Dr. Patrick Johnson, Director of Learning at Place to Be. Thank you all for coming in to talk to us. Sam, first of all, you started experiencing your depression when you were 16. Did you get any support back then from your school?
I felt it hard to open up with the school, but the school I went to was quite a small one, so there wasn't any mental health support that I've ever been made aware of. So I ended up having to try and find my own help outside of school, which was difficult.
And what would have been the perfect scenario for you? To have someone within school that you could go and speak to when you needed to?
I would definitely say to have someone within school that's available both during school and after school, and also a place to go to if you're feeling a bit low, because in my school, like when I was once feeling low during a lesson, I wasn't even allowed to be in the first aid room because I was told that unless you're like dying, basically, you're not allowed to be in there, which was hard for me because I was in a very low place mentally. But mental health isn't viewed as seriously as, let's say, a broken leg. So it just causes a lot of problems.
Because it's invisible, isn't it? And that's
Exactly.
the thing. Someone sees a broken leg and they feel that they can fix it. Danielle, how did you and your family feel when it was suggested that your 7-year-old daughter should get some counselling and support?
I thought it was a good thing because she wasn't feeling good about herself. She was unhappy with herself and said, "Mum, I'm not pretty, I'm not nice, no one likes me. No one wants to be friends with me," which is hard when you're a parent to listen to your daughter saying stuff like that.
Oh, she's so young as well.
Really young, and you're kind of in a quandary because you want to just say, "No, you're beautiful, you're amazing," and Place to Be really helped us in a big way. It was a place that she could go to talk to someone who wasn't her teacher, wasn't her parent, wasn't in charge of her, so she could actually sit down and just talk over her feelings and her thought process.
And so was this a case of the school reaching out to Place to Be? How did it actually work?
Well, she was very upset one day and she had wrote on her hand that her teacher doesn't like her. So I was called in and I spoke to her teachers and they said, actually, we've got a Place to Be. I didn't know very much about it, but I sat down with Paula McGee, who was really helpful, and she said, it's just some time she can spend talking to someone else. So my husband wasn't for it at the time, but we discussed it and we said this could be good for her, so let her go. I didn't understand that they have like a drop-in day service where you can just go in if you feel sad at any time. So she'd actually dropped in a few days, like in the weeks previous, which I didn't know about, and it worked for her.
Dr. Johnson, explain the importance of that support, because some people may watch this and say, 7, that's really young. It's not a mental health issue. They're just feeling a bit sad as a child.
Well, I think you're absolutely right, and it's interesting listening to Sam's point as well, and having that safe space somewhere where a child feels, you know what, I can just stop off and talk about whatever's on my mind. Sometimes it is those playground difficulties that we see, there's no doubt about that, but sometimes as well it's more significant issues that some children might be facing. And having that supported environment where a child can speak to somebody who's not always a member of staff from a teaching point of view, it allows them the comfort to just explore those feelings. And as you say, 50% of those mental health difficulties that we see in adulthood start before the age of 14. So early intervention is really quite key.
And Nicola, you did this at your school.
Yeah, and I am an absolute advocate of the need to break the taboo about mental health. I mean, I think our royal family have really helped put mental health on the map and at the forefront. And actually what we were talking about before is that mental health isn't always the big diagnosed issues that we hear about. It's actually a child who's not feeling happy in themselves or doesn't want to worry mum, or, you know, there are issues that affect learning. And if schools are better equipped to pick up some of those needs, then it can only serve to be better in the future.
So have you seen a wider benefit across the school?
Absolutely, absolutely. We have certainly seen improvements in how children just work and sort of collaborate with each other. They're really empathetic of one another. They can talk about their feelings and recognise that they're beginning to feel a bit sad, and they've got strategies that they can go and use to bring them back up again. So we've seen benefits in results, we've seen benefits in just children generally being happier about bouncing into school, having another person to talk to. So it's been absolutely fantastic.
Sam, do you think there's still a stigma surrounding mental health? I mean, clearly Nicola's talked there about the royal family's involvement, Prince Harry talking about his own challenges. Do you still think that stigma is there, particularly for children?
I would definitely say it's improved over time, but I would definitely say there's still stigma. So speaking from my own experiences, there's a lot of misconception about, for example, depression. So a lot of people think depression is just having a bad day, when in fact it's a clinical condition. And there's also a stigma surrounding other mental health conditions, that you might just be attention seeking or the selfishness of it, when in fact it's the stigma around it that's making people think that, as opposed to the condition itself.
Danielle, have you found that it's made your daughter become a lot more confident and be able to work through things herself?
Yes, it has. She actually got a school report and they said we've seen like a big change in Deanne, which was really nice for me and her dad to read. And I noticed a change at home. I mean, her sessions lasted, I would say, 7 months. And afterwards they said to her, do you feel like you need to come back? And she said, no, I actually don't need to come back anymore. I feel really good. And it's actually helped her with the way she deals and copes with her feelings. And when, as you said, she starts to feel down or she starts to feel sad, I see her come out of it quicker and not get as angry.
Dr. Johnson, lots of adults, when they seek counselling, they say it works for them because they don't want to put that load, if you like, on their loved ones. They don't want their loved ones to worry about it, but they can sort of give it to a counsellor and feel better. Do children think in the same way as that?
I think there's definitely an element, and I think Nicola would agree as well. And we've even seen from what Danielle has said this morning that sometimes children don't want to go home, and burden is sometimes the word they use. Their mums, their dads, their carers, whoever it might be at home. So in school, and remember, school is the place where lots of children will spend a large majority of their time. And we see in schools time and time again the difficulty that these children may be facing. So it's a really good place to start to think about what are the difficulties that some of these children are facing in school themselves.
Particularly when you're 6, it's very difficult to articulate that you've got a problem. So again, I think just having those professionals around who can help unpick that is really key.
And it's heartbreaking, as Danielle said, powerlessness as a parent. When a small child says that to you, you just want to make it better, but you don't always know how. People who are watching us are getting in touch with their experiences. We've had this tweet from Flutterby. My daughter has suffered anxiety since the Manchester bombing. CAMS, which is the Child and Adolescent Mental Health Services, refused to see her, and it's taken until now to get help. It's disgusting how hard this has been. We've also got an email here from Maria. Schools are not coping with the problems they have at the moment. I don't think it's up to the school to have to put them through this. It's time for parents to step up and start being parents instead of passing the buck. Do you want to respond to that, Daniel, and then I get Nicola's view?
I don't think that it's not quite fair, is it? Because when you think about a parent has their children's best interests at heart. So obviously, I want to see my children happy. So you can do as much as you can at home, but sometimes it's just not quite enough. And sometimes, as we've said before, burdening mum and dad, they feel like, oh no, it's okay. There's many times Deanne has started a conversation and said, actually, mummy, don't worry about it, I'm fine. And I look in her eyes and you try to kind of probe it out of her, but she doesn't want to talk about it. And she actually got really happy every week, knowing Wednesday I'm going to speak to Louise, who she really bonded with. And I didn't ask what conversations they had, but sometimes she'd come home and say, Mum, it was just such a lovely conversation. She just asked me how I am and why I feel like that. I saw a difference.
Nicola, some people watching this may say, look, school budgets, we all know, are incredibly tight. I mean, in schools in my local area, some of them have stopped teaching on a Friday in the afternoon because they simply don't have the money, and others are considering doing the same. People say this is a lovely idea, but if it's at the expense of other things in your school, surely that's not right.
Yeah, I mean, the issue is really, really complex. So I think in response to whoever was in touch, there is a need for everybody to step up. I don't think that blame should be set squarely on the school or on parents or on CAMS or on whoever. We need more funding in order to be able to support children's mental health early on in schools. we are constantly balancing our budget. At New North, my governors are absolutely committed to mental health, and they will say, Nicola, we want you to find X number of pounds so that we can at least have the service 2 days a week, and then that's my job to find that money. But there is
where
a constant
do you find it from?
Well, it comes through our school budget. We have to balance, you know, what another person has said about the CAMS waiting list. Actually, that tension that gets put on families, it will come back to impact in the school environment. So I do think schools need to be proactive in trying to balance out and look at some of those foundations that are really going to make a difference if a child is to succeed academically.
And I think, you know, we need to remember that schools are under immense pressure. People like Nicola as head teachers have lots to deal with, and children's mental health is only one aspect of it. Exam performance, day-to-day running of the school, teacher retention. We're not expecting teachers and head teachers to become mental health experts. And that's why there is a need to have that mental health professional in schools themselves. Funding is always going to be one of the constraints that we see. It has been for a number of years, but actually from the research that we've done now, it's about understanding as well. And sometimes head teachers are a little bit worried about what type of therapeutic approach should I put into my school, and they lack the confidence because they're not, and they should not be, mental health experts. We need to think about who can we bring into the schools who are qualified, who have worked with children and young people, who have worked in schools that can actually deliver that service that Nicola and you guys have talked about.
Let me read you these comments which are coming in. Harbour has tweeted saying mental health counselling for school pupils is vital. Craig's gone in touch to say, when I was around 7, my mum and dad got divorced after a few years of vicious arguments. It turned me into a weird kid and I got bullied loads because of it. Psychological counselling definitely helped me to get through it. And just a quick question from Brenda, and you may be able to help us with this. My 10-year-old granddaughter could do with this sort of service. Where do I find out more information?
So I think, first of all, you know, there is definitely some really great information online. So Place to Be has been working with the Heads Together campaign and some other of our charity partners, and we're about to launch our Mentally Healthy Schools website later this term. And I definitely would recommend having a look on there, and it gives some really good advice about what to do. But speaking to a GP as well is really important if you feel that it's at that level. But get in touch with the school. Sometimes the school is a really
speak directly to the school. Also, every local authority should have a local offer. So if you look on their website, they should have information about where to seek advice.
Now, I've just remembered we've got a government statement which I'm meant to be reading out. I completely forgot to say, so I do apologise. The government has got in touch to say to support schools, the government has pledged £1.7 billion to help improve children and young people's mental health and well-being. This includes improving the links between the NHS and schools, speeding up access to more intensive support and boosting capacity to ensure early intervention. Thank you all so much for coming in today.